What if one of the most controversial conversations from the COVID-19 pandemic was happening privately while millions of Americans were hearing a very different message publicly? Newly released text messages from Dr. Anthony Fauci's government phone are now putting that question back in the spotlight, and Republican Senator Ron Johnson says what the public has seen so far may be only the beginning. The messages date back to January 2021. When COVID-19 vaccines were still relatively new and questions about vaccination during pregnancy were especially sensitive. According to the newly released records, Fauci was communicating with then CDC Director Rochelle Walensky and Vivek Murthy, who would later serve as Surgeon General. In one message, Fauci raised a specific theoretical concern. After a second mRNA vaccine dose, significant fever and what he described as a cytokine storm could theoretically be associated with miscarriage during the first trimester. That message is now at the center of a political fight over whether officials were fully transparent about what they knew and what they were still trying to understand. Senator Ron Johnson, Wisconsin Republican who chairs the Senate Permanent Subcommittee on Investigations, says the message raises much bigger questions about informed consent and public health communication. Johnson has been investigating COVID-19 vaccine safety and federal health officials for years, and in July he formally requested a transcribed interview with Fauci concerning his role in the pandemic response and vaccine safety. But here's where this story gets complicated. A private message expressing a theoretical possibility is not the same thing as scientific evidence that a vaccine causes miscarriages. That distinction is critical, especially when the issue involves pregnancy and medical decisions. The original 2021 research involving 827 completed pregnancies reported 104 spontaneous abortions, or 12.6%, and concluded that there was no obvious safety signal, while also acknowledging that more data were needed, particularly for women vaccinated earlier in pregnancy. Johnson has argued that the numbers were presented in a misleading way because about 700 of those 827 participants received their first eligible vaccine dose during the third trimester. He has therefore promoted a much higher calculation based on the remaining group. But that does not establish an 82% vaccine-caused miscarriage rate. The underlying study did not say that all 104 miscarriages occurred among those 127 women vaccinated during the first or second trimester, and the published analysis specifically cautioned that the data were preliminary. That distinction is important because a dramatic percentage can create a very different impression from what the actual study demonstrated. And there is another major piece of the story that cannot be ignored. In August 2021, after additional safety data had accumulated, the CDC said an analysis involving nearly 2,500 pregnant women who received an mRNA vaccine before 20 weeks did not find an increased risk of miscarriage. The observed miscarriage rate was around 13%, which the CDC said was similar to the expected rate in the general population. The evidence has continued to grow since then. The CDC's current pregnancy guidance says studies involving more than 1 million pregnant women around the world have not found an increased risk of miscarriage, preterm delivery, stillbirth, or birth defects associated with COVID-19 vaccination. It also says COVID-19 infection itself can create serious risks during pregnancy. So what exactly do these new Fauci texts prove? They show that senior health officials were discussing potential risks and uncertainties privately in early 2021. They also provide fresh material for critics who believe the government should have communicated those uncertainties more openly. What they do not, by themselves, prove is that Fauci knew COVID vaccines were causing miscarriages and deliberately concealed that fact from the public. And that distinction may become even more important because Senator Johnson says the investigation is far from finished. His office says the government phone contains a much larger collection of communications, and Johnson has indicated that additional records could reveal more about how officials discussed vaccine safety behind closed doors. His broader investigation has already included allegations about federal safety monitoring systems and whether warning signals were properly handled. For Americans who lived through the pandemic, this is bigger than one text message. It goes directly to a question that could shape public trust for years. When government officials are making decisions during a crisis, how much uncertainty should the public be told, and how quickly? The Fauci messages don't settle that debate. In many ways, they reopen it. And if more records are released, the real story may not be what one official wrote in January 2021, but what the complete record shows about how scientific uncertainty was handled when millions of lives were affected. For now, the evidence points to a private discussion about a theoretical risk, followed by later studies that did not find an increased miscarriage risk. The investigation, however, is still moving forward. If you found this update helpful, don't forget to like the video, subscribe to Unix Media, and turn on notifications so you never miss the latest news. Thanks for watching.